Hi Danielle, how are you doing today?
Oh, I'm doing pretty good. How are you?
Good, good. Okay, so just wanted to touch base with you this week. I know that I gave you that homework assignment.
Yep, I did it.
Okay, you did it. Good, good. So I wanted you to write down um, just everything that you recalled from the day of the accident and anything that you felt like writing about, just kind of the experience that you had. And if you don't mind, maybe I could have you read it aloud right now. Is that okay?
Sure.
Okay.
I it's been weird thinking back about the whole situation. I remember at the very beginning, I just felt very disassociated with myself. Like I didn't really feel like it was happening to me. It felt like it was happening to my body, but not me. And I didn't really believe that it had happened. But then after, I just started realizing that it really did affect me, and I would start crying at my doctor's appointments, and I wouldn't want to watch anything about cars, like even TV commercials. Or, I just realized it's not. Yeah, it really is starting to affect me more than I thought. And I guess when it first happened, the hardest part was that I'm so used to being independent that I wasn't able to help myself, and so just getting used to that's been really hard. So yeah, I just wrote a lot about how I felt at the time. Like I remember during the actual accident, it almost felt like I was playing a video game. And then after, when the car actually flipped over for this last accident, and I was just hanging there, I realized my fight or flight kicked in, and I realized I needed to get out of the car, and this was like an extremely dangerous situation that I'm in, and then it just was a blur after that. I got rushed to the hospital, the other driver, in traffic, it was a mess.
I can understand how that would be really overwhelming, and that's just quite an experience. How do you feel right now talking about it to me?
It still brings up some bad feelings, and I'm still kind of feeling anxious about just even kind of going anywhere. I mean, whether I'm in a car or not, it's just a strange feeling. I don't feel as mobile as I used to, I guess.
What kind of support do you have right now? Do you have friends or family helping you?
My family is back in the Midwest, and I'm just kind of taking a break right now from school and work. It's supposed to be finals right now, but I can only do so much because I'm still taking pain medication, and it's really been difficult to get schoolwork done when I'm already kind of drowsy from that medication. And it's just been really, really challenging to be so kind of dependent on other people.
That's completely understandable. I'm really sorry that happened. That just sounds like an awful experience, and I'm glad that you were able to share with me. It makes complete sense that it would still bring up some feelings of anxiety that's still fresh, and that's a very dramatic experience. I heard you say something about you feeling anxious when you see cars on television. Can you tell me a little bit more about that?
I just don't really want anything to do with cars right now. I mean, it's not my favorite place to be, that's for sure. I just don't really have a good mindset about that. And I am mean, even just watching people drive, like I said, on TV, it's like on a TV show or a commercial, I just want to just change the channel right away.
Yeah.
I don't really even want to ride in my friend's car. It's like, I'm okay as a passenger, but it's still not great for me. So, as of right now, I would rather not have anything to do with cars.
Yeah. That's very understandable. So just, if I hear you right, just basically anything having to do with cars just brings back those feelings of anxiety that, remind you about your car accident, things like that.
Exactly.
Kind of avoiding the situation almost. How do you feel when you think about maybe driving again?
Too scary to think about even right now. I just feel like I have so many other things I need to do first. I can't even begin to think about that, even though I know I'm going to need to sooner than later for my job and my other responsibilities.
How have you been doing, taking care of yourself during this time? How have you been coping with the stress and kind of dealing with everything that's been going on?
Well, I've been sleeping a lot, which is really great because I don't get enough sleep usually, so it's been nice. But it's just more of reminding myself that I'm only able to do so much right now, and I need to just take a couple steps back and realize like I'm not really able to perform at my normal level because I'm injured, and it's just being patient with myself, I guess, in my situation is the hardest part.
Yeah, absolutely. And just realizing that you have been through such a major traumatic event, that's really great that you're able to acknowledge that, there is only so much you can do right now, and being patient with yourself, allowing yourself that time to heal and your body to heal, your emotions to heal and everything.
And I still feel like very scared about the idea of getting back out there, but I know I need to do it sooner or later, I guess. And I don't know, I guess I've kind of had a hard time sleeping as well. It's like with my medicine, it obviously helps me sleep, but when I'm not taking it, I feel way more anxious, and I feel like it's harder to kind of calm or clear my mind and get some rest.
You say it's harder to clear your mind. What thoughts are you having that are getting in the way of you getting rest? Are you worried or anxious about not working or school?
Well, yeah, to say the least. All my regular responsibilities are just on hold, and I think that's stressful for anyone. But I think also just, I don't know, like I'll lay there at night and I'll see pictures in my mind of the accident and just like remember what it felt like, so specifically how I felt hanging upside down in my car, and just it was like a moment of sheer terror. And it's just, I don't like thinking about that when I'm trying to sleep. I usually can't really help it.
Yeah, that's very common. That's not something that's abnormal for someone who's gone through something as traumatic as you have, a car accident, for you to re-experience the moment that you were in the accident. That's really normal, and over the course of the next couple of sessions, we can really work on coping mechanisms that you can use when you feel yourself begin to re-experience, or if you feel those intrusive thoughts of you hanging upside down in the car, or anything having to do with the car accident, things that make you feel anxious. or even you feeling anxious, which affects your life in that you don't want to drive or you don't really like anything having to do with cars. You're avoiding situations with cars. Yeah, we can work on ways that you can cope to help de-stress, de-escalate the situation, and to help calm yourself down, because it has produced a lot of anxiety, it sounds like, in your situation.
It really has. It's just like everything's stressful enough, and to add this to it is just crazy.
That is, yeah, I can only imagine with grad school and with working, and then you have your accident and your body doesn't feel good and you have to rely on other people. Yeah.
And I'm not able to use my mind to its normal capacity because I have to, take the pain medication. At this point, it's kind of essential, and except it does affect the way that I'm able to do my schoolwork.
Right.
And I have to do it either way. It has to get done. So that's been hard too.
So what do you do now when you feel stressed? Do you reach out to others, or do you kind of have some quiet time for yourself? What have you been doing lately?
Lately, I guess I'm just trying to ignore it as much as possible, but also just maybe I just kind of keep it inside. I don't know. I guess I should talk to people about it, but I don't like talking about it just as much as I don't like thinking about it.
Yeah. That's understandable.
Yeah.
Well, over the next couple of sessions, I think we can do some things that can help reduce that stress. One type of technique is a mindfulness-based technique, and then another one is a progressive muscle relaxation technique. These are ways to just help you kind of stay focused and just reduce the stress that you're feeling and the anxiety, and just to have that state of calmness and serenity. So would you like to try before we wrap up our session right now?
Okay.
So I'm just going to have you close your eyes if you don't mind.
Okay.
And I'm going to describe a situation for you. So you are in a calm meadow with no one around, no cars, no roads, just open fields and lots of sunshine on your face. You can hear just barely the chirps of the birds off in the distance. You feel calm, you feel peaceful. No one's going to interrupt you, nothing's going to bother you. There's nothing you have to do at the moment but concentrate on the sunshine and the grass between your toes and your hands. Just something like that can help you with de-stressing.
And we can feel better.
Do you? I'm glad.
That makes me want to take a nap.
Oh, good. I'm so glad. Is there anything else you want to talk about?
I'm sure I'll think of more to talk about for next time.
Okay. Well, just in between our next sessions, I want you to just, whenever you feel that anxiety, just to try to center your breathing and your focus internally, and just try to reduce the anxiety as much as possible. I know that's easier said than done.
Yeah.
And just take note of situations or people or things that cause more stress and triggers, we call them, trigger your anxiety. And we can discuss that further next session. Does that sound good?
Yeah, that sounds good. good.
Okay, thank you so much,
Thank you.
Danielle.
Okay, I'll see you next week.
I'll see you next week. Bye.
Bye.